For all of these reasons, I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
James Chow, he is the World Health Organization Goodwill Ambassador and host of China Current. What does it mean for global trade and global travel?
But when you look at this public health emergency of international concern, what it really does is provide a framework and activates that framework, that process, so that member states can really work through a joint and coordinated action. What it does is, one, it issues specific recommendations so that these member states can work together, but also at the same time it specifically says that member states should not take excessive action. So in a sense, what WHO is able to do is to monitor and engage all its member states to make sure that the right actions are taken at the right time. And as you said there, a couple of days ago, they didn't declare this emergency. A couple of days later, they did. And I think that's just an indication of how fast-moving all of this really is.
And the Director General especially mentioned this is going to be a challenge for those nations without sound healthcare system. What exactly does it mean by that?
Well, I mean, he made it very clear in investment of trust in China, but also confidence in its leadership, in its health workers, that is able to control the epicenter of the outbreak in Wuhan going outwards. But it's very much an acknowledgement that there are varying degrees of strengths of health systems all around the world. And some of them, he says, are very ill prepared for an outbreak of this kind. I took part in the Global Preparedness Monitoring Board launch back over in New York in September, where Gro Harlem Brundtland, a former WHO Director General, said very specifically with Dr. Tedros that our world is at acute risk of disease epidemics and pandemics. They're going to cause a loss of life, they're going to upend economies, they're going to create social chaos. So what he really is doing over here is trying to avoid that. And what we need to do now is to go beyond this, to say this is another wake-up lesson for the world, to really be prepared in the systems, to adequately fund them, so that outbreaks or not, we are able to deliver on health for people. We refuse to listen to the lessons that history has given us. Just 2 years ago, it was the 100th anniversary of the Spanish influenza of 1918 that infected 500 million lives and could have killed up to 100 million of them. I appeal to anybody listening right now, put aside your panic, listen to the information, go to WHO, whichever sources work for you in your local health departments, and follow that bit of advice. Dr. Tedros said this is a time for science, not for rumors. This is a time not for stigma, but solidarity. But preparedness is going to be key